So, thank you so much, Dr. Camp,
Mhm.
for joining me today. Dr. Camp is the program director of the Johns Hopkins General Surgical Residency Program in Baltimore, Maryland. She is a graduate of Johns Hopkins University herself in the surgical residency program and is the current program director. I really value your time today, and I think that you're going to provide some invaluable information to students looking to apply to general surgical residency. So, without further ado, I'll jump right into the questions. And again, we truly appreciate your information, knowledge, and feedback. So, first question I have for you is: do you evaluate some of the allopathic or MD candidates and osteopathic DO candidates separately? For example, do you have stratification systems to begin with, or are they generally considered in the same pools?
I mean, I can only speak from my own perspective. I realize each program does this differently, and so that is something to certainly keep in mind. I think there are ways to stratify applicants of all types, whether it's MD, DO, or just applicants from different countries, different schools, etc. I would say in some cases there are stratifications that we do from an initial perspective, and then we also look at the entire group and certain ways to break it down. But I would say there's no necessarily one stratification that we do at once and then never look at anyone else ever again. So I would say it kind of it depends a little bit, but pretty much all the applications that we receive are all in one big group.
Fantastic. Thank you. That's a common misconception that students have, especially with the single accreditation system, that
Mhm.
applicants and students are looked at in the same pool and basket. Next question for you. Are there specific things that you want to see in a candidate's application in ARIS? Are there certain things that make candidates stand out to you?
Well, I would say within the application, obviously, there's many things that the application encompasses. I would say, at least from my perspective, the things that I look at, I look at grades from medical school. I look at their board scores. I pay a lot of attention to their personal statement because I think that's the one thing that comes through the most in terms of who this person is and will they be a good fit in our program. Letters of recommendation. And then also how the applicant sort of describes their most meaningful experiences. The most personal things in the application are the personal statement, their meaningful experiences, and then of course their letters of recommendation. And I think in this era of not having really hardly any objective data within our applications, we end up paying a lot more attention to the more personal aspects of the application, which involves a lot more reading and looking at all the different aspects of the application, but it is a very holistic review.
So there's not one specific thing. It's really looking at the whole applicant. So it's important for students to understand that
Mhm.
it is being well-rounded and really figuring out ways to kind of have yourself stand out and engaging yourself in different aspects of medicine and clinical care. So, especially given that step one has become pass fail in the last few years, how do you utilize the step one and step two scores? And regarding the COMLEX one and COMLEX two scores, do you evaluate those as well? Are there systems that you use to compare the two, or just kind of evaluate them in one large pool?
Yeah, well, I would like everyone to have passed step one, so that is a requirement, and we want all of our applicants to have passed step one. And I will say the vast majority of applicants have passed step one now that it's pass fail, so that's really not an issue anymore. For step two, often I will use a very low cutoff for step two because I do want to be very holistic in my review. So I do not use a high step two cutoff when I'm reviewing applications specifically for that reason. Um, you know, Comlex 1 and Comlex 2, we don't see as many DO applicants, and so those scores are less familiar to me, I would say, than the step 2 scores, but I don't have a specific cutoff.
That's good to know. And one thing too that I share with students a lot is a lot of students now are taking in the osteopathic world, taking step one and step two anyways, in addition
Correct.
to the COMLEX. And there are some comparable ways to look at the two of them. And a lot of programs do that. And I'm sure you have as well. So it's just important for students to know that scores are just one aspect of your application, that there's definitely a holistic approach. So I appreciate you re-echoing that so students understand that metrics are a portion of the candidate, not the entire thing.
Correct.
So you touched on it a little bit in the previous question about using kind of a low cutoff in the step two score because now step one is just pass or fail. So is there in the selection process, are there filters? You know, do we filter out scores before reviewing applicants sometimes? For example, applicants who may not have passed step one the first time. Can that really be a barrier or a difficult thing for them to overcome in the application process?
I I would say, do we have the ability to filter out by that? Yes. Do we have the ability to filter out by people that have scored extremely low on tests? Yes. Um, I think the concern from a program director standpoint, if someone really struggles with standardized testing, are they going to be able to eventually pass their boards? I mean, that is always a concern for people that have not historically done well on standardized tests. Now, is it an all or nothing? No, it's not an all or nothing, but it is something that can give us pause when we're reviewing applications. And had over 1,800 applications that we received. And when you're trying to narrow it down to 75 people to interview, comparing people side by side, someone that did not very well on test taking scores versus someone who did well and they're otherwise equal. There's always going to be something that differentiates one person from another.
Thank you so much. And I actually just wanted to build on that statement that you had made about the correlation of
Mhm.
scores to passing your boards after you complete residency. And a lot of students may know this, some may not, but there is actually evidence and correlation of certain scores that are obtained during your standardized testing, really starting from your USMLE 1, USMLE 2, and 3, in addition to Complex 1, Level 1, 2, and 3, that there is a correlation between the ability to pass those tests
Mhm.
and pass your board exam and become a board certified surgeon. So, can you talk a little bit more about that and why that's so important for students to understand as they're going along this process? Because it's important to not only recognize that students have different learning styles and there could
Mhm.
some students can be great physicians
Right.
and really can be great physicians and just struggle with standardized test taking, but it is a legitimate concern and a realistic concern to
Mhm.
understand that there is a correlation that students have to understand. So these are things that they have to weigh not only for their surgical career choice, but also the programs have to weigh that as well.
Correct, and programs are judged based on residents once they graduate, and whether or not they pass their boards on the first try, or pass or don't pass, or need more than one try to pass. And so, the quality of a residency program is judged based on, do their residents ultimately pass their boards. So that's a metric that programs are evaluated on. And so that's why when we're thinking about applicants and who we would want to interview and who we want to be a part of our program, that is, again, it's not the whole picture, but it is something we have to take into consideration. Understanding that, yes, do sometimes people have a bad day when they're taking step one or step two or complex test? Of course. But if someone has, a pattern of really struggling with standardized tests, it just gives us pause in terms of, do we think that they will ultimately pass their boards? Because the board pass rate of residents who graduate from our program is evaluated based on that board pass rate.
In terms of the application, there are other aspects besides just the scores we talked about. Do you consider research in the decision making process?
I mean, it's one of the things that we look at. I mean, we are an academic training program, so we, expect that most of the applicants that we will be considering highly will have had some research experience. Now, that looks different for every person. Sometimes, depending on what medical school they attended, dictates how much of an experience they might have been able to achieve during their medical school training. Some institutions may not have as much exposure for medical students who have participated in research during school. So we certainly take that into account. But usually we're looking for some sort of dedication to some sort of academic endeavor. It doesn't have to be basic science for everybody. Some people, yes, some people no. But whether it's investment in a clinical research project with a faculty member, whether it's, some people have had other research experiences either before or during medical school. So really just looking for some sort of exposure and dedication to pursuit of academics is what at least I'm looking for applicants applying to our program. Um, because we are an academic training institution, and most of our residents will spend 2 to 3 years during their residency to do research, an academic research experience. for 2 to 3 years in the midst of their clinical training. So for us, that is something that we look at closely. It doesn't necessarily need to be, hundreds and hundreds of publications for sure. That's not what we're looking for, but some sort of dedicated interest and investment in, pursuit of an academic experience with respect to research.
Thank you so much for that answer. One of the things I wanted to just kind of add to that and piggyback on is to have students understand that research varies depending on the program that you're going to. Like you mentioned, Johns Hopkins is an academic institution, one of the oldest in the country. And so, one of the things that is important that when you're selecting your program that you want to go to, you have to kind of make that decision within yourself as a student. Do I like research? Is that something that I really want to incorporate as part of my training? Like you said, if they are applying to Johns Hopkins, that's going to be kind of a mandatory aspect of their residency program.
Mhm.
There are some residency programs that are more community based and they're still going to have a great surgical training experience, but maybe not as research heavy. So those considerations are important, not only from their application strength, do they have a lot of publications, but do they want to continue doing that in the residency front? Because if they do, they really need to consider the programs that they're applying to. Because an academic program that is in the threads of an academic program, that research will be an aspect of your training.
Right.
So should an applicant complete a sub-I during their third or fourth year rotation schedule? And how do you recommend that students go about choosing their sub-Is?
A sub-I in their home institution or an away sub-I, or both?
Or both?
Both, okay. I mean, we certainly would expect that all students would have at least completed a sub-I in their home institution, just for that higher level of clinical exposure and experience compared to their core rotation during their third year of medical school. It is a different experience being a fourth year sub-I compared to being a third year general surgery rotation student. So we would expect, a sub-I in general surgery at their home institution. We don't expect an away rotation or an away sub-I for our applicants. It's not expected. It's not something that we require for sure. But if they have it, great. If they don't have it, it makes no difference. It's not realizing for other specialties, it is very different. So for plastic surgery or neurosurgery or other specialties, it is almost required or expected that you will have done an away rotation at programs that you are seriously considering. So, you have to take that into account. It varies based on specialty, but for general surgery in general, you do not need to do an away sub-I, for applications.
Thank you. That's so important because I do get that question a lot. And I feel like students start to kind of freak out during their third year about, oh my goodness, where how am I going to arrange all my sub-Is? And it becomes this whole conversation. And I do think it's important for students to understand it's about getting a well-rounded surgical education, which they can also do at their home institution that'll prepare them for residency. And for those students that are choosing to do sub-Is, when they are on a rotation with you as a sub-I, are there certain things that you are looking for or expecting? How are you really evaluating them on a sub-I?
I mean, on a sub-I, again, the expectations are a little different than your general surgery sort of core rotation as a third year student. It's really, taking more initiative, having a little bit more responsibility. You're still not a resident, you're not an intern, but you should have a little more understanding of patient care. You should have a little more understanding of the flow in the OR. You should, you know, be a little more proactive in clinic and et cetera. And I think also with an away, especially with an away sub-I, or even with a home, it's your home institution sub-I, it's figuring out the fit. Like, do you fit in with the residents on the team? Like, do you seem like you're going to be someone that other people work in our program would work well with? So I think it's not even so much the assessment of the faculty sometimes as the assessment of the residents that they work with in terms of, is this a person that we think would be a good fit in our program? Is this someone that we would want to see as an intern in our program next year? I think that's, you know, and from the faculty perspective, probably, is this someone that we want to train? Is this someone that we think would be a good fit in our program, and that we would want to train and graduate at the end of their residency program?
I think it's important for students to understand that choosing a surgical residency program It's kind of like choosing a relationship, and it's a long-term relationship
Yeah.
because the people that you enter that relationship with are going to become your family for the next 5 to 7, 8 years,
Mhm.
whether you like it or not. You're going to see them more often than you'll probably see your own family. You will sleep in similar quarters, you will eat in similar quarters, you will wear similar clothes, you are going to be very close-knit. You have to be collegial, right? So there's professionalism, and then there are obviously friendships that happen outside of the residency, which is natural, right? Some of my co-residents are some of my closest friends still today, some of my best friends. So that doesn't always happen, but knowing that you have to be able to live and work with that group of people for the next several years is important. And those are some of the things that you want to assess as you're going to these sub-Is and going to these rotations. Because I always look at it as it's not just I'm being interviewed or by the program, but I'm also interviewing the program. So
Right.
that's the way the student should look at it. I want to see if they think I'm a good fit, but I also want to see if I'm a good fit for them. So it's kind of a two-way street. So students have to remember that because you do have choices, but the
Mhm.
program has choices, but also you have choices as a student. So
Mhm.
to keep that in mind when they're selecting their program. So thank you so much for that insight. Now, networking is a really big, buzzword and thing that students are talking about, how to network, how to create these connections to learn more about programs and really just kind of get in the sphere or the aura of program directors or other people that are integral in the selection process. So how do you best recommend that applicants and students network with program directors or programs that they may be interested in the future?
Yeah, that's a great question. I mean, I think for students, especially, all residency programs have a website, right? There's a lot of research that you can do online. Um, I think certainly if you've had other students from your school that have gone on to different residency programs across the country, reach out to them and say, "Hey, do you like it? What are the pros and cons of this program?" Because they went to your medical school, they have a good sense of sort of what your experience is as a medical student, and how are they doing? How do they like their residency program that they are at now? I think you can get a lot of information from recent graduates from your own school. There's a lot of programs will have sort of even virtual open houses, as usually in a sort of August, September-ish, when and the application season gets underway. So you can learn a lot about programs just from meeting either the program director or other faculty and residents specifically from the program. So there's a lot of opportunities just to sort of reach out without even having to travel or go anywhere, but just to, whether reaching out virtually or online to sort of learn more about different programs. And I think the best thing I always say is to talk to the residents in that program, whether it's someone you know or someone you don't know. I mean, most programs, the residents are going to be the ones who can give you the best insight about their experience as a trainee, what they like, what they don't like, what they were thinking about as they were going through the application process. Um, I think that they are going to be the best source of information regarding the program. And especially if it's someone that either or even went to your own school, I think they can also give you a better sense of you know how their experience as a medical student prepared them for residency.
And in terms of the preclinical years, so during their second, first years, what are some of the things that students can do to set themselves up for success when it comes to being good applicants for surgical programs? So, what are some tips that you would have for those first or second years that knew that they were born out of the womb to be surgeons?
I think one thing you should always think about especially if you know you're interested in surgery as a first or second year. I mean, some people don't figure it out until they actually do their clinical rotations, but if you know early on that it's something you're really interested in or interested in, thinking about or pursuing, reach out to the surgeons at your home institution. Say, do you mind if I come shadow you in clinic or the OR? Most surgeons are going to be happy to have you come and shadow them and tell you a little bit about what they do every day. And I think that gives you a good sense of, is this the career or the specialty for you? So don't be shy about, reaching out, even as a first or second year medical student. I've had a ton of first and second year medical students that have come and shadowed me in clinic or in the OR sometimes. And I think it's a good experience for everyone. And, so don't be shy about that. I think, once you get to your clinical rotations, you'll obviously have more interaction with faculty and with residents. And I think at that point, maybe get a little better insight. But I think even as a first and second year medical student, most schools probably, I know our school does, I'm sure other schools do as well, have a surgery interest group. So there are things that you can pursue even as a very junior medical student in terms of just attending those meetings and learning about opportunities. Sometimes they'll do like skills sessions or things like that, even just to teach basic suturing. Um, so I think a lot of schools have sort of a surgery interest group experience that you can participate in, even as a first and second year medical student.
Fantastic. Thank you so much for that. Now, in terms of letters of recommendations, what makes a strong letter of recommendation and who do you prefer that they're written by? Do you need them to be written by surgeons? Can some of them be written by surgeons, some by primary care or other specialties? What makes a strong one and what are your recommendations for who should write them?
But from what makes a strong letter recommendation, it should be someone that knows you well. Asking a famous person to write you a letter when you've only sat in their office and met with them for 20 minutes is not going to be helpful because they don't know you well. So it should be someone that you worked with on your general surgery rotation or someone that you worked with on your sub-I, someone that you've worked with closely that can write you a strong letter of recommendation based on their experience and their interaction with working with you. Because we as program directors want to know, is this person have the have what it takes to be a general surgery resident? Is this person hardworking? Are they good with patients? Um, Medical students may not always have a ton of exposure to technical skills, but if they've observed your technical skills, then they can comment on that. Those are the things that we're looking for in a letter recommendation. More about their experience working with you and what they think your potential will be going forward in the future. And the only way someone can write a strong letter of recommendation is if they have worked with you closely and know you well. So I think that's one of the most important things. I would say applying for a surgical residency, most of your letters primarily should be from surgeons that you've worked with during medical school. But that being said, if you've done extensive research with someone who's not a surgeon, maybe worked with someone who's PhD or in another specialty, if you've done extensive research with someone who's not a surgeon, they should write you a letter because that speaks to your academic experience. Um, so I think the most important thing is having people that know you well and can speak to your work ethic, your sort of experience that they've had working with you so far, and what they think your potential will be in the future.
And if you had to give three characteristics of the ideal applicant for a general surgical residency program, what would they be?
Uh, I would say probably hardworking. So good work ethic, hardworking, team oriented, because I think that's one of the most important things about being a surgeon, but especially being as a general surgery resident is being able to work and function within the team environment. Um, and self-motivated. I think that's the other thing. There's many more characteristics I can think of. I'm trying to think of the three most important, but I think being self-motivated because surgery residency is long. Both the hours and the amount of work that goes into it, and so I think you need some intrinsic self-motivation to continually practice and refine your skills and your clinical judgment. So I think it's self-motivation, hardworking, and uh, I forget now what I said.
Self-driven.
So, yeah, yeah,
So thank you so much, Dr. Camp. It's been really great for you answering these interview questions for us. And I think it's really going to be very helpful to our students who are navigating this journey of general surgical residency application. I wanted to ask if you can take maybe a minute or two and just let us know about the Johns Hopkins General Surgical Residency Program. What are the number of residents that are in your program? Because it's a relatively large program, one of
mhm.
the largest in the country. In addition to that, how many residents do you take per year? And what number of applicants do you kind of filter through, and how many do you end up interviewing? So if you don't mind, just kind of give students who might be interested in this
Yeah.
program that information.
Sure, I'd be happy to. I mean, obviously, I'm very proud of my program. I think it's a wonderful training program. It is an academic training program, and we're really looking to train the future leaders in academic surgery. And that looks very different for different people. We certainly don't want to match all of the same type of person. So we're looking for a very diverse class and people that are going to go on to do very diverse things in the future with respect to their careers, whether that's in surgical education, whether that's sort of leadership positions in the field of surgery, uh, clinical leaders, uh, academic or research experts in the field. So again, we're looking for a very diverse group of people based on their experiences coming into residency. And then during the training process, our ultimate product is really to train the future leaders in surgery. So that is our overarching goal. Um, in terms of the number of residents we have, so at any given time, we usually have somewhere in the range of 10 to 11 residents that are kind of in their research experience. So our total number of residents that we have right now is 65. 54 of those are clinical, and 11 are research residents within their research time. We have both categorical and preliminary residents, which is why our number is so high. We graduate about 7 chiefs per year. We match 6 categorical interns per year, and then we usually have um, roughly about 12 or 13 prelim interns that we match each year as well. Some of whom stay with us for 2 years in general surgery, others who are just doing 1 year of internship before going on to anesthesia or radiology or interventional radiology or something else. So we have a very large intern class. It's usually about 19 or so interns within our intern class. Again, some prelim, some categorical. But we ultimately graduate 7 chiefs per year.
That's awesome. Thank you so much for giving students that insight into the Johns Hopkins General Surgical Residency Program. Again, Dr. Camp, I truly appreciate your time today, and your answers are going to be so helpful to students navigating this journey. So thank you so much, and you have a great rest of your day.
Well, thank you for having me. I appreciate the opportunity to share a little bit just about the whole, demystify the whole process because I think it is a very confusing process for all applicants. It's an exciting time, but it is sometimes a little bit anxiety inducing and a little bit stressful because it seems like a big mystery. But I would encourage applicants to get as much information as you can, whether it's online, virtually, or by talking to other residents. Seek out experiences early on and during the application process being thoughtful about how you come across as a person because I think that's what program directors right now are really looking for when they do their holistic review. Who are you as a person? What do you bring to the table? What will you bring to our program? Are you going to be a good fit for our program? And is this a person that we would be excited to train and graduate from our program?
Wonderful. Thank you so much again, and you have been wonderful. So thank you.
Thank you.